What causes kidney stones? The biggest kidney stone on record weighed more than a kilogram and was 70 centimeters in diameter. The patients didn't actually swallow a stone the size of coconut. Kidney stones form inside the body, but unfortunately, they are extremely painful to get out. A kidney stone is a hard mass of crystal that can form in the kidneys, ureter, bladder, or urethra. Urine contains compounds that consist of calcium, sodium, potassium oxalate, uric acid, and phosphate. If the level of these particles get too high or urine becomes too acidic or basic, the particles can clump together and crystallize. Unless the problem is addressed, the crystal will gradually grow over a few weeks, months, or even years, forming a detectable stone. Calcium oxalate is the most common type of crystal to form this way and account for about 80% of kidney stones. Less common kidney stones are made of calcium phosphate or uric acid. A slightly different type of stone made of either magnesium ammonium phosphate or strepsils can be caused by bacterial infection. And if rare stone can result from genetic disorders or certain medications. A kidney stone can go undetected until it starts to move. When a stone travels through the kidney and into the ureter, the short edges stretch the wall of the urinary tract. Nerve endings embedded in the tissue transmit extricated pain signals through the nerve system, and the scratches can send blood flowing into the urine. This can be accompanied by symptoms of nausea, vomiting, and burning sensation while urinating. If a stone gets big enough to actually block the flow of urine, it can create an infection or bad flow and damage the kidneys themselves. But most kidney stones don't become this serious or even require invasive treatment. Masses less than 5 millimeters in diameter will usually pass out of the body on their own. A doctor will often simply recommend to drink a large amount of water to help speed the process along, and maybe taking some painkillers. If the stone is slightly larger, medication like alpha blockers can help by relaxing the muscles in the ureter and making it easier for the stone to get through. Another medication called potassium citrate can help to dissolve the stone by creating the less acidic urine. For medium-sized stone up to about 10 millimeters, one option is polarized stem or sound waves. As the corporate shock wave lifter strip uses high-intensity pulses, a focus on tremendous energy aimed directly at them. But pulses create a vibration inside the stone itself and small bubble just to solid. These combined forces crush the stones into the smaller pieces that can pass out the body more easily. But zapping on a stone sound doesn't work as well if it's simply too big. So sometimes more invasive treatments are necessary. Our Gillette tube called a stent can be placed in the ureter to extend it. Optical fiber can deliver razor pulses to break up the stone. Stone can also be surgically removed through the incision in the patient's back or groin. What about just to avoid a kidney stone in the first place? For people prone to them, their doctor may recommend drinking plenty of water, which dilutes the calcium oxalate and other compounds that eventually build up into painful stone. Food like potato chips, spinach, lumber, and beets are the higher in oxalate, so doctor might advise limiting them. Even though calcium is often found in stone, calcium in food and beverages can actually help by binding oxalate in the digestive tract before it can be absorbed or reach the kidneys. If you do end up with kidney stone, you're not alone. They just test the rates of rising, but their world records probably won't be broken in any time soon. One more. The biggest kidney stone on record weighed more than a kilogram and was 17 centimeters in diameter. The patients didn't actually swallow stone the size of coconut. Kidney stones form inside the body, but unfortunately, they are extremely painful to get out. A kidney stone is a hard mass of crystal that can form in kidneys, ureter, bladder, and urethra. Urine contains compounds that consist of calcium, sodium, potassium, oxalate, uric acid, and the phosphate. If the level of these particles get too high, or if you become too acidic or basic, the particle can clump together and crystallize. Unless the problem is addressed, the crystal will gradually grow over a few weeks, months, or even years, forming a detectable stone. Calcium oxalate is the most common type of crystal to form this way and accounts for about 80% of kidney stones. Less common kidney stones are made of calcium phosphate or uric acid. A slightly different type of stone made of the mineral magnesium ammonium phosphate or steroid can be caused by bacterial infection. And even rare stones can result from genetic disorders or certain medications. A kidney stone can go undetected until it starts to move. When a stone travels through the kidney and into the ureter, its sharp edges scratch the wall of the urinary tract. Nerve endings embedded in tissue transmit excruciating pain signals through the nervous system, and the scratches can send the blood flowing into the urine. This can be accompanied by symptoms of nausea, vomiting, and burning sensation while urinating. If the stone gets big enough to actually block the flow of urine, it can create an infection or backflow and damage the kidney themselves. But most kidney stones don't become this serious or even require invasive treatment. Masses less than 5 mm in diameter will usually pass out of the body on their own. A doctor will often simply recommend to drink a large amount of water to help the speed of process along, and maybe take on some painkillers. If the stone is slightly larger, medication like the alpha blockers can help by relaxing the muscles in the ureter and making it easier for the stone to get through. Another medication called potassium citrate can help dissolve the stone by creating a less excess urine. For medium-sized stone up to about 10 mm, one option is pulverize them with sound waves. Extracorporeal shockwave lithotripsy uses high-intensity pulses focused on ultraviolet energy aimed directly at the stone. The pulses create vibration inside the stone itself and small bubbles just lit. These combined forces crush the stone into smaller pieces that can pass out of body more easily. But zapping a stone with sound doesn't work as well if it's simply too big. So sometimes more invasive treatments are necessary. A rigid tube called the stent can be placed in the ureter to extend it. Optical fiber can deliver easier pulses to break up stone. Stone can also be surgically removed through the incision in the patient's back or groin. What about just avoiding kidney stone in the first place? For people prone to them, the doctor may recommend drinking plenty of water, which dilutes the calcium oxalate and other compounds that eventually build up into painful stone. Food like potato chips, spinach, lumber, and beets are high in oxalate, so doctor might advise limiting them. Even though calcium is often found in stone, calcium in food and beverages can actually help by binding oxalate in the digestive tract before it can be absorbed or reach the kidneys. If you do end up with a kidney stone, you're not alone. Data stats that rates rising, but their world records probably won't be broken at any time soon.